Now, a troubling trend in women's health. Doctors and nurses have worked hard and successfully to reduce the U.S. infant mortality rate in recent decades. What's less known and less understood is the rise in maternal mortality, mothers dying after pregnancy or from childbirth-related causes. Renee Montagne of NPR and Nina Martin of ProPublica have teamed up for a series of reports on the subject. Their latest installments came out today. Judy Woodruff recently spoke with both of them.
Renee Montagne, Nina Martin, thank you very much for talking with us. So Americans think we have the best health care, medical care in the world. How could it be, Renee Montagne, that we have this problem?
Well, there are a lot of reasons, and there's some underlying reasons that most people would recognize, and that is people, low-income women, women of color, women in rural settings have less access to the best possible medical care. But what we're finding, and what the numbers are showing, is that this could actually happen to just about anyone. I mean, we're finding women who had what would have thought to have been the best of care.
Right, and that's part of the problem, is that a lot of doctors, a lot of nurses, a lot of hospitals think that maternal mortality is something that happens in other countries. It's a thing of the past in the U.S. And so basically there are two issues that have arisen. One is that there's just a lack of recognition, a lack of awareness about what life-threatening complications look like.
And on the part of doctors, hospitals?
All of
nurses,
the above, nurses as well.
nurses.
And, patients in a lot of times, because patients also are not necessarily educated. We don't want to worry the patients. And so when an emergency does happen, the next thing that sort of kicks in is that hospitals and doctors and nurses often are not prepared for the emergency. So there's a sort of a denial and then a delay.
And there's been a lot of focus on making sure babies are born
Exactly.
healthy.
One of the things we came across in our different interviews and conversations, Bill Callahan of the CDC, who spends his life studying this, he had an article from 1950 that declared victory over maternal mortality. Women didn't die in childbirth in great numbers anymore, they said. And basically that was, in a sophisticated journal, was the beginning of an emphasis on saving babies. And of course, babies do die in much greater numbers. They are more vulnerable. But, basically everybody turned their sights to the wonderful ways you could save babies, new technology and focusing neonatal units, in the next 20 or so years became part of a good hospital, a good birthing center.
You both have done so much reporting on this. The series, of course, is running over many months. We have a clip right now of the husband of a woman. She was a neonatal nurse, so she worked in healthcare, but she ended up with either a lack of diagnosis, the wrong diagnosis, and this is a clip as I guess she's going into surgery, but where her condition has severely deteriorated. Let's listen.
So they took her to the operating room, and the neurosurgeon, he operated for, I think, about 4 hours, and when he came out, he said that she's still alive. She's basically on life support, but she's brain dead. So at that point, we decided to withdraw.
So this was Lauren Blumstein, Nina, who, as we said, a nurse in New Jersey, and they thought everything was going fine. She delivered the baby, and then things went terribly wrong.
Right. So Lauren Blumstein is an example of the kind of person that everyone assumes does not die in childbirth or pregnancy-related causes in the U.S. She had great health care. She was a nurse herself. Her husband, Larry, whom you just heard, was a doctor. He was with her in the delivery room. He basically never left her side except to take the baby up to the nursery. She came in with a condition called preeclampsia, that is pregnancy-induced hypertension. She had not had it, and she came in and her symptoms were not recognized from the moment she came to the hospital.
Are there lessons being learned, Renee, by hospitals, by medical care providers around the country as a result of situations like this?
There is something of a movement in fact, among concerned medical professionals to actually address these problems. But the lessons in any individual situation often come from the mother dying. And then that hospital may rethink what it's doing. The doctors may learn a lesson.
So it's a lack of training?
It's a lack of training and a lack of education and a lack of recognition in some cases, but it's also a lack of having a set of protocols and standards in place for when the rare emergency happens. So a hemorrhage, for example, or in Lauren's case, preeclampsia. There's a very specific set of things that doctors and hospitals and nurses should start to do immediately as soon as they recognize the symptoms, but often those standards aren't even in place in very good hospitals until it's too late and until the next time.
But again, it just seems stunning. Again, we think of the United States, Renee being having the most advanced medical care in the world. How could it be that the medical team who are working with women giving birth aren't prepared to deal with all these circumstances?
Well, when you see these stories, when you hear these stories, you actually ask that question every time. They're almost unbelievable. But the reality is hospitals have protocols, but they're not necessarily well practiced. They're not consistent. They're not lists for people to follow. You see one thing, that means the other. You don't think about it. I think it's kind of deeply embedded in the American medical system and among, obstetricians and even obstetrical nurses.
And smaller hospitals and rural hospitals are less likely to have these protocols in place because they're smaller, they'd have fewer deliveries, and so they're less likely to encounter a life-threatening complication. So that's another problem.
We started out, I think, also talking about whether there were other factors, socioeconomic status, whether women whether this was a planned pregnancy or not, whether the mom took care of herself during the pregnancy. Renee, are those, race, age of the mother, are those not factors that you found?
You know what people will say, that researchers will say, is those are all factors, and they are all there, and to some extent they are recognized. Women have high-risk pregnancies, and that's recognized. If you're obese, or if you have some kind of hypertensive disease to begin with, those things are watched. If you're in a good hospital, and of course then the American medical system is such that there are enough people not in good hospitals. So yes, these are factors, but as researchers will say, they're not the reason women die. Women die from these conditions, these complications, and there's a CDC Foundation analysis that has it that 60% of all these deaths could be prevented.
Wow.
The underlying conditions that women die from are not age. It's not being obese or being African American, although African American women do die at 2 to 3 times the rate of white women. It's heart disease, some sort of heart-related condition, or a hemorrhage, or preeclampsia, or an infection that's not diagnosed.
Or treated well.
Or treated well.
I mean, these are the
exactly.
things they're dying of. They don't, in all instances, need to die of them.
Right.
A wake-up call in so many ways. Renee Montagne, Nina Martin, thank you very much.
Thank you.
Thank you.